Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we're going to be discussing how do you get rid of a Doweger's hump, or this bump that starts developing on both male and female patients. Now, Lori has been under care for some time, so her Doweger's hump is already improved significantly. But what this comes from is a condition known as forward head posture. That's when you're looking at it from the side, your head is forward, it starts rounding your shoulder, and then these tissues start to increase in size, and they get fibrotic scar tissue in them. And it's very, very common both in men and women with this forward head posture, and that is epidemic in our society. So I'm going to take you through a full treatment to show you exactly how we deal with this problem. First of all, we're going to check her posture. Let's flex your head forward and backwards. Now see, she had some restriction there and also a kink right there, now normal. Her posture's improved significantly, but she still has a high left shoulder, and you can see the forward head posture and the Doweger's hump right here just a little bit, not too bad. Used to be a lot worse. Okay, so first thing, Lori, let's have you lay on your back right here. The first thing I'm going to do, and this is critical in getting rid of this, is to decompress the entire spine from the occiput down to the sacrum on the y-axis. So first thing we do is we lift the patient's legs up to where they're parallel with the floor so that we can relax the pelvic musculature and the paraspinal musculature all the way from the pelvis up to the cervical spine into the occiput. And then we pin these pins in very tight. Make sure the pelvis directly underneath of them. There you go. And this one here. Now a lot of patients complain that that's tight, but you want it tight because you don't want them slipping through. Then we wrap up just a plain bath towel and put it right under the occiput. Wrap around. You want to make sure the patient's teeth are closed and have them breathe through their nose. And just like that. That was excellent. You feel that all the way through?
Yes, sir.
Very good. And we always check the patient's reflexes. Now you notice that her, just relax. The next thing we do is we let the table down, and then we're going to have her come over and lay prone on the BioPhysics adjusting table. So what I'm going to do is move this. Yep, you notice how she's getting up sideways, which is the way you're supposed to get up. Very good. And let's have you lay on your tummy right here. Put your face right down in there. Now, even though we're talking about Doweger's hump here, we need to make sure that we are correcting the entire spine, because if you don't correct the entire spine, this will never stay. So first thing I'm going to do is I'm going to let her head forward just a bit. And as you can see, her right pelvis is sticking up, and that's probably a little tender right there on her right side. Right leg is short by 1/2 of an inch. Gets even when I bring it up, and her pelvis raises up. So we're going to adjust the right sacroiliac joint first, because when the base of the spine is correct, then the other lumbar spine vertebra and thoracic spine vertebra have a stable, normal foundation, if you will. Just like the foundation on your house. If your foundation is straight, your beams and your house is going to be straight. However, if you have a tilted or twisted foundation, then you're going to have the Leaning Tower Pizza House. So we don't want that. Now I've adjusted her pelvis three-dimensionally on the XYZ axis. Now we're getting L5, L4, L3, L2, and L1. Now, what we're going to do here is now get the lower thoracics. Very good. This is a common stress area. Here's the mid-thoracics. Excellent. Mid-thoracics. Now you notice that my angle changes as I get in the upper thoracics. Excellent. Now I'm going to have her scoot forward even more Now notice I have her flexed forward. That spreads out the joints in the upper thoracic spine. Alright, one more. That's it. Now here comes the most important adjustment in getting rid of this Doweger's hump, which is the T1 through T4. Okay, let this go. Hump right there. Now, what I'm going to do is I'm going to put some very deep, steady pressure on the trigger points in her upper thoracic spine, paraspinal muscles, the trapezius, levator scapula, and rhomboid musculature. Those are pretty tender, aren't they, Lori?
Oh, yes.
Now, the most important thing is to get that forward head posture back, which is exactly what we're going to be doing towards the end of this treatment. And there we go. Now let's have you turn around on your back for me, please. Now on her, we are going to get way down into the lower cervical, upper thoracics, and I want you just let me have your head. Perfect, good job. That was C6, C7, T1, and that was the same. Very good. Good. Now, let's have you go ahead and set up sideways again. I'll help you up. Now, we're going to adjust the shoulders in this area too, because you want to make sure the shoulders are lined up along with the clavicle and the sternum. Very good. Excellent. Now, let's come back over here in front of the mirror. And we are going to use a high velocity, low amplitude adjusting instrument on the axis of the y-axis, or of the x-axis on the atlas. Now, let's flex your head forward and backwards again. Much better range of motion. Much better. See, that's already gone down some, but here's you can open your eyes. Now we're going to have her lift her shoulders up, flare her palms out. Now we're bringing her head totally negative in the z-axis here. We're going to be adjusting her atlas on the right, adjusting her atlas on the left, and then at T2 and T3. Very good. Now let's try that same thing. Start from neutral, forward all the way, backward all the way, and neutral. Very nice. Now look how much better that looks. Her entire spine, forward curve in the neck, backward curve in the mid-back, and again a forward curve in the lumbar spine. This is how you correct Doweger's hump and improve a patient's posture and function. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.